having a look over the brow bone. So no edema noted in this area. I do sometimes notice swelling there, but that does look okay. And then the thyroid, that looks okay. Okay, so noticeably cooler here at the fingertips. Actually, I'm getting too low of a reading just at the very tip of your fingers there. So again, could indicate some issues with your circulation. Alright, Samantha, we're going to go ahead and get started with your examination today. I have you in for a stethoscope auscultation, so I'm just going to be listening to various areas of your upper body, kind of around your temples, carotid artery, as well as along your chest, so that I can hear your heart, make sure everything's functioning normally. Brief assessment of your lungs as well. So that's mainly what the examination is going to consist of. I will also be palpating around with my hands. Essentially just means I'll be feeling around for any abnormalities, any areas of tenderness, swelling, pain, that kind of thing, and a brief check for any temperature variation. So is there any symptoms you're having today? Any like pain, tenderness? Okay. So I'll have you lay down in a position that's comfortable for you and we can go ahead and get started. The table need adjusting at all? No, I'm okay. Okay, all right. So we will go ahead and get started. I'm going to perform just a very brief visual inspection. So I'm going to just kind of have a look, see if there's anything I note that could be concerning. So I have my pen light. It is fairly bright. You don't have to look at the light. You can either close your eyes or just look away. Okay? All right, so starting here at the head, I'm just going to have a look. Any swelling? So I'm not noting anything around the face. Just having a look around the clavicle. I don't see anything there either. Collarbone is equally protruded on either side, and I don't see any asymmetry at the chest wall. The shoulders are also very well aligned. Having a look over the brow bone. So no edema noted in this area. I do sometimes notice swelling there, but that does look okay. And then down along the thyroid, I also don't see anything. No areas of swelling, nothing that looks concerning there. Okay. Upper body as a whole is well in line, so that's good. I'm going to have a secondary look with this tool here, and this just allows me to have a bit of an up-close view. It's magnified so I can just have a bit of a better peek here. So I'm going to hear and feel me a little bit closer to your face for just a few minutes. I'm just having a look at the brow bone again, as well as the eyelid. Having a look at the orbital socket and the bone just beneath your eye. Also having a look at the mastoid. And a closer look here. The thyroid, that looks okay. Alright. We're just going to have a brief look here at the hairline as well. And it also looks okay. Not noting any signs of discoloration. Nothing here that looks concerning. No signs of discoloration or flaking, so that's all good. Alright, Samantha, so before I begin with the auscultation, I'm just going to feel around with my hands for any temperature variation. I want to do this before I start applying the stethoscope to your body so I don't indirectly affect the temperature coming off of you. Okay? Alright. I'm just going to feel around with my hands, just kind of getting a general sense of overall body temperature. So far, skin is warm and dry to the touch. No sense of excess clamminess. I'm not feeling any excessive moisture. No signs of sweating. Skin is warm but not overly hot. Just gonna come here at the top feeling bilaterally here. No sense of excess heat coming off of the scalp, which is a good sign. And if I feel along the jawbone here as well. That feels okay. Also feeling for any signs of swelling as I go, so slightly noticeable decrease in temperature here around the clavicle, just a bit cooler than up at the head. Neck is warm around the thyroid. Just going to touch your hands as well. Okay, so your hands are quite a bit colder. Is that normal for you? Yeah. Okay. So I feel like you have some circulatory issues there. Certainly your hands are very, very cold, but that's okay. All right. Okay. You can go ahead and relax. Just going to go in with the secondary test here. So this is just a regular thermometer gun. It's just going to allow me to test for temperature variation. So test here at the cranium. We have baseline temperature to start with. So we want an average reading. So far we're getting 98.4. Slightly cooler in some areas. Slightly warmer around the throat, which is very normal. And noticeably cooler at the chest wall, but certainly not concerning. I'm going to test directly along the chain of nodes. So I'm going to go ahead and test your hands. I just want to see. Okay, so noticeably cooler here at the fingertips. Actually, I'm getting too low of a reading just at the very tip of your fingers there. So again, could indicate some issues with your circulation. Okay, all right, you can go ahead and relax your hands. Use this next tool because I did get a little bit of a variance in certain areas. I'm going to glide this along your skin just to give you an example. And the area that I move it across, it'll give me more of an average read for that part of your face or part of your neck. Okay? So I'm going to start here at the head. I'm going to move just across the forehead. I do apologize, this is rather cold. Good, okay. This is telling me that across the surface area there is an average reading that's in line with normal. So there aren't any areas that are, particular hot spots, nothing that's jumping too vastly from one side to the other. Here, side of the neck. Then I'll go down the whole of the left side. Good. All right. I'm just going to turn your head here slightly. I'm going to test this other side as well. So starting here at the forehead. Good. As I come down, right side of the face. Good. And coming down the side of the neck here. that was a little more in line with average, so that is a very good sign. So lastly, before I use my stethoscope, I'm just going to perform some palpations in the area. I just want to feel around, feel for any abnormal nodules, specifically feeling along your lymph nodes and areas that tend to hold on to any excess swelling or fluid. And you haven't been ill recently, correct? No. Okay, good. So just feeling along here. Good. So this is just going to very gently feel along the thyroid itself. I apologize if this is uncomfortable. No signs of rigidity there, and it's fairly mobile, which is good. I'm going to hold here, Samantha. I'd like you to just swallow for me. Very good movement there. Okay. So lastly, just feeling along the clavicle itself, collarbone. We have a chain of nodes that runs here as well. That feels okay. I'm not noting any swelling there. Just feeling briefly along the upper extremity and not feeling any swelling. I'm just going to take this hand here, Samantha. I'm just going to hold up here as I feel along. Nothing abnormal there. Alright, this side as well. So aside from the cooler hands, the upper extremities and upper body as a whole feels fairly normal, so that's a good sign. So I'm going to go in with my stethoscope now. All right. Just ensuring I have the correct side there. So you're going to feel me place this along your skin. It does feel slightly cold, but shouldn't cause you any discomfort, okay? All right. So I'm going to start here at the temporal region. And just getting a base for what I can hear. Perfusion is strong. Higher. So come down along the cheekbone here. Come down here at the chest wall and listen directly below the clavicle. Good circulation here. So far, no notable signs of any occlusion or abnormality in perfusion. You're getting adequate blood flow to the various areas of your body. I'm just going to check up here near the shoulder. Coming just centered at the chest wall. Once again, I'm hearing good flow here, nothing that sounds occluded. Just gonna have you turn your head here slightly for me. So again, starting on the temporal region. Very good. Have you turn your head for me just slightly in a position that's comfortable but well maintained. Now listen here at the clavicle. Very good. Just going to listen in a linear pattern directly along the chest wall and compare bilaterally from one side to the other. Very strong heartbeat here. Very good. No notable abnormalities there. So I'm actually just going to listen here at the hand. I just want to see if there's anything I'm hearing, if there's any lack of circulation. Slightly less audible there. You can relax that hand. Okay, they are even symmetrically, which is a good sign. I'm not noting any distinct differences from one side to the other. All right, you can relax there. All right, I'm going to do one final auscultation directly along the carotid artery. Just take normal breaths for me. right, Samantha, you can go ahead and relax. So the good news is, as far as your auscultation assessment, is that everything sounded fairly normal. So I didn't hear any areas of occlusion. It didn't sound like there were any areas where you weren't getting good circulation from your heart. All of your arteries are clear. I didn't hear any like arrhythmias or any tachycardia, bradycardia, your heart's not beating too fast or too slow, or any abnormal heart rate, which is fairly common. It all sounded fairly steady. I would say slight lack of circulation in the hands. Your hands are fairly cold, but if that's something that's common for you, then it's not particularly alarming. I would say that becomes a concern when you can't start to feel things. So just like you can feel sense of touch here along your face, and all of that should feel fairly symmetrical. If at any point you start to notice that you don't feel things quite as much in your fingers, then we might need to come back in and do a different kind of assessment. But for now, as long as you're able to feel everything normally in your hands, that should be okay.
Okay.
All right. Okay. So everything else looked fine. Your temperature slightly varied in certain areas, but your overall average was well within normal limits. I don't think I have anything else for you today. Did you have any questions for me?
No.
Okay. Well, thank you so much for coming in. It's always a good idea to have your cardiac health looked at. So I'd like to see you again next year for a very similar examination.
Okay.
All right. Thank you.
Thank you.
Get home safe.